Now to an update on the Ebola outbreak in the Congo. An American doctor working there has tested positive for the disease. According to the World Health Organization, there have been 250 suspected cases and 80 suspected Ebola-related deaths. I want to turn now to CBS News medical correspondent Dr. Céline Gounder. She is an infectious disease specialist who spent time in Guinea as an Ebola aid worker during the West African epidemic. Dr. Gounder, thanks for being with us. And first off, what do you make of what we are hearing about this American doctor, and what can potentially be done as far as a course of treatment?
So this doctor is a surgeon, and so that would imply that he has very significant exposure to bodily fluids. We also know that there is a shortage of personal protective equipment on the ground in the DRC for a whole host of reasons. Part of this is because USAID was dismantled. USAID was providing logistics and supply chain support. In addition, you have armed militia all throughout the area, which makes it also very difficult to get supplies. So we know that they've been dealing with a shortage of PPE. Could that have contributed to the risk of infection? Possibly, we don't know. And in terms of the doctor's clinical status, we don't have a lot of detail yet. We only know that he's symptomatic. This has been confirmed to be Ebola. There are two other physicians involved, his wife, who's an obstetrician gynecologist, and one other doctor. Those are the other two are considered also high risk exposures. And then we believe that the others who are being evacuated are the four children of the surgeon and OBGYN. So those are your seven. They are being medevac to Germany. We do not know if that will be a U.S. military facility or some other facility in Germany. And as for medical treatment, the treatment for Bundibugyo, this particular species of Ebola, we don't have specific treatments. It's really about providing supportive care. IV fluids are actually a very big part of that.
Yeah, and just to dive deeper in terms of that assessment that you laid out very well, and some of the challenges that you articulated. I guess ultimately, what does this mean for the potential spread of this outbreak? Is this something that can be contained, or is it just simply managing it at this point?
I think we can expect a very large epidemic in this part of the world with occasional exportations outside the region.
All right, Dr. Celine Gounder, thank you so much.